All right, welcome in everybody. Let's go ahead and get started. Today we're going to talk briefly about actions. Again, as I said before, this is just kind of a list of topics, but we'll probably have some time today to do some free-for-all stuff. If anybody has any burning topics, we could discuss best practices on what's going on. But for right now, let's go ahead and just kind of talk a little bit about actions. So Rusty just mentioned an example of where he used an action was for somebody who had some lung nodules found on CT that needed to be followed. I've used the actions for that exact same thing before. Um, in fact, I think I still have an outstanding action on a patient of mine I've been following lung nodules on for probably way too long. Um, but anyway, that's a great example. Do you guys have a basic idea about how actions work? Let me just show you. So from Hub is how you create them. So test patient, you go to actions, you create new action. This is the action, and an action basically, in very general terms, is kind of a tickler for an upcoming care item that you want to get done on the patient. So example, the repeat CT lung nodule scan in 6 months or a year, an abnormal pap smear. We already have a designed protocol that we use to track abnormal pap smears through this. I guess some other things, maybe somebody you just want to see back in 6 months to check on something. So no, you create the action from the hub right there. You have action, new action. It'll have the patient's name. And there's a couple of fields here. They're a little busy, but it takes just a few seconds to get them filled in. There's some drop downs here. And you can free text all these as well. So you could even put, this one you can't free text. You have to pick something here. So lab X-ray follow-up would probably be the most common thing. But then this one is free textable. So you could put, you could just title it lung nodules, lung nodule follow-up, for example. And then you assign it to yourself. So again, hopefully you have your ellipsis here with just your favorite peeps. If you haven't done that, that's a really nice time saver. Set up your favorite peeps. And then from here, start date, default sit today. Sometimes I'll timestamp it and give a little clinical history.
So the radiologist was saying, like, I forget the Fleischmann criteria. I can't remember,
Yeah,
but they were just saying like
yeah,
follow-up it was either 6 or 9 and 12 months. So I would just write that down in the notes. Is that correct?
totally.
And then Tate was saying that you could just create a TE once that comes up to schedule the patient, all that stuff.
Yeah,
And
perfect. Yeah,
and
go
then
ahead.
I would assume like this one that has like different intervals. I would just maybe change the start date or due date or something every time it comes up for the next 3 or 6 months or whenever I'm supposed to do the. Is
Exactly.
that how?
Yep, that's exactly how I manage this. So then from here you pick your due date. So let's say it's due in 6 months. You probably want to set it to come due in 5 months. You can have the time to do it. So basically I'll just hit this button 5 times, 1, 2, 3, 4, 5, and that'll be the date that it comes. It turns my jelly bean yellow. And then from here, you have to, one really important step, and I've seen people fall down when they make actions, you have to put in progress here. Um,
Oh, I've done that.
if you don't,
On
then
my first,
it doesn't happen. That's the big take-home message from today. Yeah,
yeah, the first two I did not do that.
yeah, yeah. Don't do that again. So that's that, and you click OK, and then it's in your box, and you're off to the races. The other thing you can do is a recurrent action. I haven't used this very much, but potentially you might want to for a really delicate situation, whatever it may be. Um, and I still prefer just when it comes due, then you repeat it for when it's due again. So if you're following something every 3 months or every 6 months, so on 4/22/2017, I like Tate's practice, and I do the same thing of now creating a telephone encounter right here from the hub. Telephone encounter, and then from here you can create the order for the CT chest, assign it to your team, write a note to your team, say, hey, get this scheduled, and then you can go back into your action. You can timestamp it and write, TE to team to get scheduled, and then change the due date to another 6 months or another 3 months, whatever it may be, and then click OK. And now it'll fall back out of your needing to be done jelly bean and yeah, you're off to the races. I don't use this recurrent. If anybody else does, feel free to pipe in. But yeah, this is something you can have frequency apparently every hour. Wow. Um, days, weeks, months. You could probably put 6 months. Um, and last due and last done. No end date, and that'll just every 6 months you'll get an action on this patient for whatever it may be. Maybe you just want to ping yourself about somebody who you want to check in on, whatever it may be. I haven't quite created any templates. Maybe I have. Um, yeah, so MMR postpartum. So you can actually create actions templates. So um, let's see. Let's go ahead and see if we can create one. I did this some time ago. I don't use this, but if you created an abnormal PAP, um, PAP follow-up, the subject would be abnormal PAP assigned to, I guess you probably don't want it assigned to somebody, just leave that one blank, priority low, click OK. Well, then you could come in here, so if you had, now that we created that, if I create a second action, let's say test Alicia has an abnormal PAP, I come in here, I create new action, I go merge template, and I can choose abnormal PAP. There you go, I filled it all in for you. That's pretty cool. Hadn't quite done that yet. So you could create a template for your actions. So that's maybe something we could use for folks.
Just at that caret right there, new template, and away you go.
Yeah, I guess if you did copy template, if I hit, I guess you can't really update them. Maybe if we made something a little more robust with like a 6 months on the abnormal PAP. I guess if you were so inclined, you could, anyway, we'll have to play around with that. Feel free to play around with it. Let's see, new template, there we go, that's what I was missing. Oh, add, here we go. Let's try another one, normal PAP. Updated. I guess you can't really fill in any of the other fields. So I guess what we built was fine. You can't, I was thinking if you could specify the time frame, but sometimes you're going to want to do 6 months on an abnormal PAP, sometimes a year. So I guess the one we created is probably just fine. At least it just fills in those fields for you. That's pretty cool. So there's an abnormal PAP action template. And then just change your dates. Make sure you click in progress. Again, big take-home message. You can change the priority to where it's high priority if you want, and then it's make sure jelly bean red instead of yellow. That's kind of cool. And then again, your due date, however far out you want, and you're going. And that's pretty much it. It's not these are one of the more intuitive things, I guess. Timestamp, whatever it may be. Click OK. You gotta make sure you assign it to yourself. So that's basically actions, and then just so everybody knows, the actions live in the right chart panel. This is maybe some, if you've ever looked here in the DRTLA tab, the A stands for action. So if you scroll down to the very bottom, you can see outstanding actions on this test patient. So there's a breast mass action, lung nodule follow-up, and abnormal PAP, and then needs repeat PAP, yeah, basically. So this patient has 4 outstanding actions. And when they're due next. These aren't due till 2017. This one's due today because we didn't change the date. So you can kind of see this. That's kind of nice to know. The other place you can see actions on a patient is from Hub. So right here you have view actions. And I can see even previous actions that have been closed out on the patient. So I've had that question before about where do you see an old action once it gets closed out. Second HPV. Not a bad idea to use for actions is to track HPVs, vaccines. So then once that status gets changed to completed, that's how you close out an action. So that's how you view old actions. Apparently there's a lot. Yeah.
I don't know if you can create actions for the group, but I was thinking HPV, that would be a great one for a group.
Yeah.
Templated, where everybody can just grab a templated action and
Yeah.
do HPV, like for all the MAs, they can just
Grab an action, throw it in, and
yeah.
I like it. Yeah, I think that there's could be some real power in those action templates. Yeah, let me put that on my list here. I have an ongoing list now of all these awesome ideas we come up with and improvements. So
Yeah, it may be that the colposcopy group can make a suggestion. In other words,
yeah,
they just make a suggestion, hey, when you have this, do this, and
yeah,
then create an action for all the providers, can do that action as suggested by the colposcopy group, for example.
yeah, exactly. An action template for abnormal PAP for COPO. In HPV action, can you guys think of any other places you might want to use an action?
I'll do it sometimes when it's calling and checking on a patient. Like
Yeah.
I'm not going to have them come back for an appointment because I don't think it's necessary, but I want to just call them.
Yeah.
So I think it's a possibility, or at least helps you remind your team or something.
I think that's great. I suffer from a small disease known as using your jelly beans as a file cabinet, and potentially, so if you were to create an action now, you don't have an outstanding TE that you wanna. I sometimes will follow patients through a TE, but they sit in my jelly bean box. But I think to your point, you could create an action that renews, in 2-3 days. If you want to call and check in on somebody, it's a quick phone call that doesn't necessarily need an appointment. I think that's a great use of an action. So you don't have a T jelly bean. Yeah.
Another suggestion is for gestational diabetics.
Yeah.
GTT, a 2-hour GTT.
At 2 months.
Yeah.
Yeah. We've played around with some different action mechanisms for that. No, we actually just approved a protocol last week to where health ed department, when they see the patient for their gestational diabetes education, they're going to create an action at that point. And then they are going to case manage that action and keep pinging teams until their 2-hour GTT gets done. So that's a method in which we're using actions to manage a population of patients to get an important screening test done. And so we've used actions at a pretty high level with the diabetes case management team. I won't bore you with all the details, but we got to the point where those were pretty effective ways to manage populations of people. You'd create an action on all the people who were a certain, high-risk diabetes with A1Cs that were high and different things. And so that's how you can actually go into actions for the whole organization. If I show you briefly, apparently I have 3 actions currently. If I change this to assigned to, you can change this to somebody who's a case manager, for example, that would have all the actions assigned to them. So, for example, health education is going to have all the actions of patients with gestational diabetes in their box, and they'll be popping, 2, 3, 4 a day, who knows how many, that she and her team will then be actionizing and pinging teams to get their 2-hour GTTs done. So, great thoughts. Yeah, I don't think we have any. The care coordinating provider is what I'm pretty sure we cleaned all these out previously, so. Oh, great. I'm going to have to cut that out from the recording. Got all the PHI on there. Awesome. So anyway, that's actions in a nutshell. Any other thoughts on actions? It's 7:49. Spent about 20 minutes on that. Any other best practices? Briefly, just so everybody knows, the way that you receive an action is through your jelly bean. You click on this, then you'll get actions right here. You'll get a number. I'm not going to click on mine right now. But instead of getting an actual jelly bean, you actually get a T letter and then that's how you know you have them. And your number will not go up on your T's, but your actions, your telebeam will change colors. So that's actions. Anything else on actions? Should we open up any other hot topics? Maybe we could jump in if you want to just kind of freestyle here about how to create templates. That's something that's on your list, Russ. And then Carl, you wanted to talk about where to document things in the diabetes. I'm going to hold on that. I just want to confirm that I have all the right information for the numbers getting pulled, but documenting.
That's fine. Another day's better for me probably anyways. I got a private run here.
Hey, if you guys have 3 minutes, let me show you something really cool on the Ouch formulary if you're not doing this. I sent an MJLE on this and people didn't quite capture. So I was going to maybe do a video on this, but right now, so can you guys see my Ouch formulary now? I moved it over.
Yeah.
Okay. So if you go right here on filter and you click filter on sort and filter, then it puts these filters in, which you probably don't have, depending on your Excel settings and how it pulls up from you the intranet. So if you do that, then you get these drop downs, and what you can do from here is you can go to your classification. I can hit this, and then I can uncheck. Then I can go down to gastroenterology, gastrointestinal agents. Yeah, it needs a little help on how those get broken down, but then I click that. Now I'm looking at just GI agents. Now I can go to a subcategory. I can uncheck, and I can go to just PPIs, for example. And now I'm looking at just PPIs, and then let me show you the best part. I can go to my cost profile right here, and I can click this, and I can sort smallest to largest. So now I've just loaded the cheapest PPIs at the top. Everybody see that? So I got a Meprazole continues to be the cheapest per tab. You can actually change it smallest to largest per tab. 3 cents is Dexilent is 3 cents per tab. I sent out a little blurb on that for 30 or 60 milligrams. So that's per tab is 3 cents, whereas omeprazole was 42 cents. But I think on a bigger scale, you can get omeprazole cheaper. But Protonix or Nexium right here.
Is Dexilent 30 cents, not 3 cents?
Dexilent is 3 cents for a tab. So for 30 tabs, your bottle price here, and then I use the fields here.
I mean, my other point is like, it looks like it's 0.3 instead of 0.03. I mean, I'm just questioning whether or not. Do you see what I'm saying? It's not 0.03. It's.
Oh yeah. You're right. It's 30 cents a tab. Thank you. Yeah.
So it's still cheaper, but I mean, it's not like.
You're right. It's 30 cents as opposed to 42 cents for the omeprazole. You're absolutely right. Yeah.
Okay.
Yeah.
This is cool. This is helpful.
Yeah, and then one thing on view right here I can show you is you can freeze your pane at the top. If you can see this, so if I do freeze pane, top row, now I can see as I scroll, I can see what those fields mean. Hold on, that didn't work. Unfreeze panes, freeze top row. Because you can never sometimes remember. Apparently that's not working. Maybe not. I got too excited. Unfreeze, but yeah, it's nice to know what these categories are. Because sometimes you want to know. And we've all kind of learned right now that this is a per tab, and this is how many you get, and this is.
Chris,
yeah.
Can we suggest that when they send this out, before they save it and send it out, that they do that before they send it?
I've requested so many times. Yeah, it's, I know. I mean, we could go in and put these in smallest to greatest and save the actual spreadsheet and send out the spreadsheet, but it updates, every 3, 4, 5, 6 months. No, I agree. Yeah, I've asked Donna at Ouch to I don't even care who makes it. I don't want to see whether it's brand or generic. I don't want to see who the manufacturer is. This all could go away. I want the name of the medicine and I want the price right next to it.
But the other question I have is why, I mean, I don't understand why so many different omeprazole. I mean, like, it just gets to be like,
Yeah.
I'd rather just be like, if omeprazole 20 milligrams is cheap, it should just be cheap and not have to like go through 30 caps, 100 caps. I mean, it's just.
Yep. Agreed.
I mean, look at all these PPIs, and there's probably really only like 5.
Yeah, that you're actually going to prescribe. Agreed.
Well, or even just, I mean, like, look at them. Like, look at the names.
Yeah.
I mean, it's just like repetitive stuff. I mean, like, I'm exaggerating with 5 probably, but I mean, my point is like, I don't know, it's a little bit ridiculous. Anyways.
Yeah. No, this thing just needs, I mean, this could be optimized in a huge way. I mean, it takes so long to try to find a cheap medication for a patient. It drives me batty. So I agree. This thing could be totally optimized. But for the time being, that's a quicker way to get to stuff. But then to get back out of this, you have to go back. You have to kind of work your way backwards. You have to go to these, add all those, and then your main category, add all those, and now you're back to all your categories.
Can you just shut it down and reopen it?
You totally could, yep. But then you,
Will it relaunch like the same, like from the beginning, or will it?
It will not. You have to go, and it's probably something. This is kind of an IT question. It's probably something we could have IT change the way the settings are set on the actual document that's on the internet that posts, to where those fields automatically pop up. But see, yeah. And that's let me put that on the list here as well, so that it pops up with the filters all ready to go. And see, this is the field this is the pane I wanted to lock. Yeah, it's not gonna. At some point, I figured out how to lock this top row so that it scrolls with you, it floats with you. But maybe I can find somebody who knows more about Excel to do that, and then we can get it optimized, set the settings set, and then repost it, so that yeah.
Screen, you can do it with a split screen command.
Say again.
You used to be able to do this with a split screen command.
Oh.
You split it.
That's right. You're an Excel wizard.
Not really.
Split screen. I'll have to play around with that. I think there's a way to make this. I mean, you can even hide entire rows. I'm not super savvy on that, but there are hide features in Excel, I know, that you can hide stuff. So we could like hide a bunch of rows we don't want to see, and then roll it out with 3 rows, so you don't have to scroll left to right, have all the settings set, and then go from there.
A suggestion.
Yeah.
We can ask whoever is the Excel wizard in the company.
Yeah.
To pre-prep this before it gets posted
and we're
just instructions. Can we have it like this, this, and this? Or we request that, here's maybe even a better way. You can request that they go and set up Donna's Excel spreadsheet that she's using to be formatted in the way that we want. If she doesn't mind, we could probably just request, hey, can we have our expert with Excel work with you to present the data in the way, and you just, it sounds like what we really need is an Excel expert to work with Donna to, when we get this on the internet, that it's just got it usable.
Totally.
It seems like it would be a good use of resource there.
I would agree. Ask Couch too. We have a once every couple of months we have the committee that meets that works on these formularies. John Lelis is kind of our representative on that committee, but I will send an email to put that on the agenda to see if we can optimize the format. I think that would be well received by the group of all the CHCs in Utah. We've tried. I've talked format with Donna at length before, and it just was not.
Yeah, Donna's got other stuff going on, and especially with the number of different things that you were going through here that we could do,
Yeah.
and way to have it formatted, it's
Yeah.
one of those things where Donna is just like, oh my God, I don't want
Yeah.
to open up worms because then we're going to be having to change the requests.
That's exactly what the problem is. Yeah, yeah, but potentially an Excel wizard could come in and assist her. So I agree. I will start to push that. I mean, this thing could be, anyway, yeah, I wanted to build it into an app on a smartphone, but
Even
may be
better,
it.
but the other thing we really would love to do, it would be even better than this, is if you could get it to be pulled in as a formulary into eCW.
Oh,
But that would be,
yeah.
I know maybe a national project or something.
Yeah, maybe we should reopen the discussion again. Yeah.
Not if all CHCs in Utah are using eCW.
Yeah.
I mean, I don't know if they all are, but it sounds like a large portion are, so maybe it would be worthwhile to everybody.
Yep. Yeah.
The point is, I mean, one thing you can say, you could request, or that the Ouch organization could request, is say, have somebody look at what would it take. I mean, what I would want to know is, what would it take to have that happen? Have who could answer that question. What would it take? How much would it cost? Maybe have somebody put in a bid to say, put out a bid that Ouch, where we say, okay, Ouch will put out a bid, and people put out bids. We don't have to accept their bids. We can decide, no, that's too expensive.
Yeah.
But maybe it's not as bad as we think.
No, and it's certainly worth reopening the conversation. We a couple years ago, maybe a year and a half ago, we actually got the eCW formulary person who builds formularies on the phone with the Ouch eCW users group that I kind of put together, and it was nothing but red tape from eCW, and they couldn't do it. And then I had a follow-up phone call with them, and I lost energy behind it. But we should reopen it. I mean, it's got to happen. That would make life so much easier. And it potentially, if it's something that we figure out we could build, I don't know. Anyway, we could figure out how to commit manpower to it.
Yeah, I think what you need is either find somebody who has the skills to get something done, a project that completely through, looking to its conclusion, or you put out a bid and say, what would it, are there outside folks who've got skills in this department?
Yeah.
And it may be that there's somebody within the IHC system, for example, or who would even be able to get their skill set to give us a hand, and they'd be able to write it off. But we need to find somebody who's got the skill set to make this happen, or train somebody to get that skill set. But we don't have a person right now, neither does Ouch.
Yeah.
But we need to ask, what would it cost to make it happen?
Yeah.
And maybe the question is, you have to ask eCW, what would it cost to make this happen?
Yep.
I mean, at least let's ask that question. Maybe that's the simplest way to do it.
Yeah.
Just, what would it cost to make this happen?
Yeah. I'm going to reopen it right now. I'm going to send a big email to put it on an agenda to restart it again, because I just couldn't buy the explanation that there's a bunch of red tape behind this. That was supposedly going to go away. So maybe that's gone away. There's 340B is a really highly scrutinized and secure benefit that the federal government provides. So there's a lot of regulation behind it. And that was what eCW was saying. But anyway, I'll reopen it. Thank you.
It's still a formulary and it's a database.
Exactly. And we do this for private insurers. We bend over backwards to get their meds in here. Come on. Okay. We'll do. I got marching orders here. Let me get going on them. Thank you.
Thank you.
Get you guys to clinic. Have a good day. Thanks everyone for joining.
Thanks, Chris.
Okay,